How to use mid-dose inhaler. Hold the inhaler canister upright. Press the middle or index finger on top of canister and thumb on the bed below the mouthpiece. Then remove the cap. Shake the inhaler 4 or 5 times before use. For the first time used, test the MDI by releasing a puff into the air. Take the inhaler from your mouth while breathing out. Press the mouthpiece between your teeth and seal your lips tightly around it. Press the canister once and keep breathing in as slowly and deeply as you can until completely breathed in. Take the inhaler from your mouth and hold your breath for 10 seconds or as long as comfortable. Breathe out slowly through your mouth or your nose. Clean the mouthpiece by tissue or dry lint-free cloth. And replace the cap on the MDI when finished. If you are using a corticosteroid medications, rinse your mouth with water after using. How to know when to replace your inhaler? Total doses of most MDIs are about 200 puffs. You can count down by yourself. Or you can guess the remaining doses by pouring the metal canister and weighing on your palm. Some inhalers show the number of doses on black side of the inhaler canister and count down to 0. How to clean MDI? Remove the metal canister by pulling it out. Clean the plastic parts of the device using water and mild soap. Let the plastic parts dry in the air before put the MDI back together. Other recommendations: clean your inhaler at least 1 time each week. Repeat all steps for each puff ordered by your physicians. Wait 1 to 5 minutes in between puffs. If you have 2 types of inhaler, you should use the bronchodilator first. Wait a few minutes and then use the corticosteroid inhaler. Use the corticosteroid inhaler continuously, followed by the doctor's order. You should not stop your medication by yourself.